We're talking about the risks attached to various activities, and we're doing so answering your questions with Dr. Christopher Labos, an epidemiologist and cardiologist who's based in Montreal, and he's been giving some excellent answers so far. Welcome back for this hour, or our first installment of this hour, Dr. Labos.
Thank you.
I mentioned we had a question about pregnancy, and indeed we have Harish writing about his wife, Jivitha, who is pregnant in her second trimester and wondering whether it's safe to visit for the regular checkup with their gynecologist at this time, and if ultrasound is safe.
So none of these things is particularly dangerous. The one piece of advice that I would give here, and this would apply to most people, speak to your physician. It's very possible that a lot of the routine tests can be deferred. So if you're going to your doctor for regular blood tests, for regular checkups, if there's nothing absolutely urgent, it's very possible that your physician can either do your visit via a teleconferencing solution, some sort of telehealth option, or really just push it back by a few weeks or maybe a month.
Because if you don't want to be in that clinic or hospital environment, if you don't need to be, you don't want to be, exactly. I suppose.
Exactly. You know, it's all about limiting the number of unnecessary interactions. So if it's not absolutely necessary for you to be in the hospital or the clinic today, if it can be deferred by a month, I think people will find that there's a lot of solutions that we can implement. Most of the patients that I interact with now, I'm calling them over the phone or using telehealth options. Very rarely do I come into contact with patients directly, unless, of course, I'm seeing them in the hospital setting.
All right. From Michelle, this is a higher risk area for sure. Her daughter, sorry, this is not Michelle, it's Micheline. Her daughter works in a long-term care residence, Dr. Labos. And she works closely with residents, helps them, for example, connect with their family as they have FaceTime conversations. Nobody at this particular residence, she writes, has tested positive, but she's wondering about exposure. So there's the risk attached, working in this environment. Should she wear protective gear?
So that's a difficult question to answer, because it's going to be really dependent on how much interaction she has with other people. If she's not having direct interaction with either patients or other healthcare workers or other people working at that institution, the risk of her getting infected is still relatively low, as long as she practices basic measures like hand washing, like keeping her distance. If she is basically just in her office, not interacting with other people, the risk is low. If she's interacting with others, then that becomes a little bit of a more complicated situation. And again, even if you're working in the same building, if you can maintain a 2-meter distance, if you can limit the number of unnecessary meetings you're having with people where you're in the same room with them, you can decrease the risk substantially. So it really depends on what your day-to-day activities are. And the biggest thing is, and I'm going to keep repeating this over and over again, is stay away from other people. If you can close yourself off in a room, in an office, in one location where you don't interact with people, that's going to be the biggest single thing that you can do to decrease your risk.
Question from the East Coast, Dr. Labos, from Roderick, and it has to do with the fact we know the virus lives on various surfaces. He bought a sofa from a furniture store in Sydney, Nova Scotia, so we say hello to everybody on Cape Breton. And the furniture store told him it was coming in from the United States. So that would take some time in shipping for sure, but the risk of ordering anything, you know, everyone's buying online right now because everything is closed. So the risk of ordering and having things delivered, he's wondering whether he should be concerned, and should he in fact stop all non-essential deliveries.
So the risk of the virus surviving on surfaces for any extended period of time is probably pretty low. Most of the evidence that people are referring to have come from small studies done in laboratory conditions, suggesting the virus can survive for maybe a few hours, maybe up to a day on various surfaces. If you're having something shipped, and that usually takes days to weeks before it arrives at your home, there's probably not going to be any virus left from the point of origin. It's very possible that if the people delivering it were sick and then they contaminated with their hands, it's possible that there might be some virus on the surface, and that's why a lot of people are wiping stuff down. I don't think that's the major source of transmission. It's not the major thing that you'd be worrying about from a public health perspective. But again, if it's not essential, if it can wait a month, just defer it for a month. Things are going to get very likely substantially better in the next 1 to 2 months. So if it's not something you need right now, and there's no reason why you need it right now, you can probably just put it off for a little bit and not worry about the risk, even if it is probably vanishingly small.
Put it on hold pretty much all of life, with the exception of the essentials at this point. But I do like that advice too. Wipe it down. Many people are choosing to do that just as perhaps an extra guarantee. C. Langley, I promised you a question from someone living in an apartment, and C. Langley is the person I'm referencing. Living in an apartment building, Dr. Labos, with a laundry room in the basement, and concerned, paranoid, in parentheses is actually what the note says to me, about using the laundry facility. So hand washing, doing everything that C. Langley can and the rest, but the laundry's piling up. It seems we're doing more laundry than ever, I think. So what's the risk of using a public laundry room?
The only real risk there is going to be if there's other people in the room with you. So if you can make some sort of protocol in your building where each of you uses the room sort of one at a time or at a specific time of day, then that's really going to eliminate most of that risk. What you don't want is you don't want 3 or 4 people in the room at the same time, because you're probably going to be in close quarters and you could potentially spread the virus to each other. The machine itself, very unlikely that it's going to be a way to transmit viruses. The virus probably doesn't survive on surfaces for all that long, and the soap and water in the laundry machine is going to be killing the virus anyway. So I wouldn't excessively worry about that. It's just make sure that you're alone in the room and that you don't have people congregating in there.
Good point. In our office, for example, here at CBC, our broadcast center, we have signs on the doors. 2 people allowed in this room at any point. 2 people allowed in our big elevators at any given point. So yes, capacity of each room is something to consider. Would it also be prudent, Dr. Labos, to take something like a wipe, and maybe, you know, sometimes those laundry rooms have great big communal tables or in the center of them where you can sort your laundry, maybe wipe that surface down just as a precaution?
Yeah, that's a very reasonable precaution. Also, the doorknobs to doors are a very important high contact area. That's stuff that we touch all the time and we don't think about it. So it's really surfaces that you have to be wary of. So wiping down any surfaces you're going to come into contact with, that's probably a big thing that people can do, not just in apartment buildings, but basically just, you know, across the board.
Anywhere. All right. Question from Martin, whose wife, Martin writes, is a cancer survivor, 5 years now, and that's a wonderful piece of news. But his wife is still going to work, and Martin says, it makes me nervous. They're keeping their distances, and other requirements are in place in order to avoid infection. But he's concerned still and wonders whether there's a risk attached to that. Should she wash the clothes that she was wearing during the workday as soon as she gets home, or is he just panicking? What's the risk associated with that?
Yeah, it's hard to know where the line between prevention and panic really is these days, because nobody's really sure. Certainly, if you're more than 5 years out from your cancer remission, that's usually the point when a lot of people, or you know, a lot of physicians don't necessarily say cure, but they say that the risk of you redeveloping cancer is very low. And now it depends on the type of cancer. It depends when the remission is. But certainly the further out you are from your diagnosis, the lower your risk is. That being said, everyone is potentially at risk. So if your job means that you have to go to work and that you can't work from home, the basic precautions you can take if you don't want to bring the virus back is wash your hands the minute you get home, and then really change your clothes. And if you want to change and launder your clothes, I mean, there's certainly no harm to that. And it's, you know, you're reducing even that small potential risk that traces of virus might be lingering on your clothing and you might bring it into your house. So if you want to change and wash your clothes when you get home, I see no real problem with that.
Certainly the doctors to whom we've been speaking on this program, I don't know if you're doing that too, or they'll just get out of their greens and wash them right away, or whatever clothes they were in their office. They're obviously a higher risk of exposure, but they have been taking that precaution, or so they've been telling me over these weeks. Denise Archer would like to know, is there some way that 2 people can be in a car safely, like one in the front, maybe one in the back, and she even suggested with masks on potentially. She's interested in taking her neighbor to get groceries. Now, right then and there, we might raise, people have suggested maybe only one person goes to do the grocery run and maybe just takes the neighbor's list perhaps and does a favor. But is there, to the larger question, is there a way for 2 people to be in the car safely?
Maybe only if one of them is in the trunk. So the answer is, you know, the answer is no. I mean, you're going to be in a confined space. Even if you're wearing masks, even if you're wearing gloves, there's going to be some degree of transmission. So, and for something that's Now, I know groceries are essential, but as you pointed out, maybe just take turns and do the grocery shopping for the other person. There's no reason for both of you to be in that cart, to be in that store. So, and that's the point, is that if you have friends and neighbors who can't go out, who are more at risk, see if there's a way that you can do the shopping for them to prevent them from having to leave the house. Because really, two people who aren't living together in the same car, that would be somewhat suboptimal right now.
Suboptimal. A question from Bradford, who must be watching on a live stream because they're in Northern Ireland, but they're Canadians, Dr. Labos, and they're able to take walks along back roads and trails, and they don't see very many people. Those whom they do, he says, are actually doing very good physical distancing measures. But he's wondering about whether, even with that distance, if that's still safe.
For the most part, I would probably say yes. If you're at least 2 meters away from somebody, the likelihood that you're going to be able to transmit virus is very, very low. So if you're going out for a walk on the outside, as long as you can stay away from people, so as long as you don't all clump together, say at beaches, as we've seen some pictures in British Columbia and in the Maritimes. So stay away from people, take your walk alone. If you see people coming towards you, maybe cross to the other side of the street so that you're not in close contact with each other. But it's really that, it's maintain that distance, because the further away you are from somebody, the less risk there is of that person transmitting the virus to you, or you transmitting that virus to them if you happen to be asymptomatic.
It has been excellent guidance from you and so practical. I really appreciate it, Dr. Labos. Thank you for being here. This is our first visit on the program. I hope you'll come back and answer some more questions in future
Anytime.
programs. All right. Thank you. And all the best to you and everybody there working in Montreal.